Hello and welcome to another edition of Health Matters. I'm Dr. Bruce Karlin for the Worcester District Medical Society and WCCA TV. And today's guest is Tina Grosowsky, and I'm going to have to read all this stuff about you because I'm going to say it wrong. But Tina is the project coordinator of the Central Mass Tobacco-Free Community Partnership, and you'll describe to us what that is. It's delightful to have you here.
Thanks for having me.
So the partnership, as I understand it, works to reduce smoking and secondhand smoke prevalence in central Massachusetts, and that you're working throughout the communities. How many communities are we talking about?
63.
63, wow. To implement the policy and educational programs and provide tobacco prevention and cessation resources. And you used to work as the substance abuse prevention coordinator for the town of Westford for 10 years. And you are a meditation and yoga enthusiast, so you've got all the tools necessary to keep us from being addicted.
We hope so, yes. Thank you for having me again.
We've been working at this for a bunch of years. As we were talking about before we came on the air, I can remember when we first implemented the increased tobacco tax, and we earmarked a bunch of the money for the communities to provide tobacco education and tobacco programs. And we had a wonderful program. I remember John Gagliastro used to run the program here in Worcester, and we were making great inroads. And then the state said, well, wait a second, there's a chunk of money that we don't have to give for these programs. And now it sort of devolves on groups like yours to take up where the others left off.
Right, we do get state funding. We're state funded through the Department of Public Health, but obviously the programs are much smaller and the reach is wider. And as I was saying, we do a lot with very little, because mostly we work at the local level to implement policies to prevent youth from starting addiction in the first place. And we help people to get resources to quit smoking. And we work on smoke-free housing to make sure that everyone who lives in public housing has a right to clean indoor air. So we've come a long way, as they say, and we've done a lot of work, and the smoking rates for both adults and teens are way down. That's the good news. The bad news is that the industry is up to their old tactics, using all of the strategies and advertising and work that they do to try and get people hooked on nicotine, and especially young people, so that now they have new products that they're putting out on the market, which young people can get both in the retail environment and online.
Well, you've said a whole bunch there, so let's back up a little bit. So the addictive portion of tobacco is the nicotine.
Right.
The stuff that really does you in is all the other unburnt hydrocarbons that you get in the smoke, as well as the nicotine. But the really addicting part of it, and so
especially for adolescents. Nicotine is especially addicting for adolescents because their brain is still developing.
Well, as I was sharing with you earlier, my father was the chief medical officer in World War II at the liberation of a bunch of small concentration camps. And while they tried to give their K rations to these walking skeletons, these guys would say, you know, no, just give me your cigarettes. That's how addicting that substance is.
That's right. It goes to the pleasure center of the brain, and it's like every other material that goes to the brain, whether it's fat, salt, we know these things now, you know, or it's nicotine or it's heroin. Because of MRIs and CAT scans, we know so much more about the brain.
So these highly addicting substances are hard to kick.
That's right.
You can't kick it. So that what we've been doing to this point to help people get off of tobacco is to find different nicotine delivery systems that would take care of their cravings, and then we could gradually taper the nicotine till they have kicked their habit. But
along with counseling. so that they understand.
Tons of counseling and
Right, right.
and support groups and all the other things you can do to make a recovery robust. Because as with other addictions,
Right.
relapse is expected.
Mm-hmm.
But having said that, what we've done here is a little bit different than our getting people off of cigarettes, which is wonderful. As my friend Dr. Bonatti says when his cardiac patients show up, he says, "Oh, keep smoking, it keeps me in business." But I think he's a little tongue-in-cheek when he does that. But there's a lot of truth to that, and anything we can do to keep the unburnt hydrocarbons out of your lungs is terrific. But you're saying that this has led to a new problem, and you slipped in that little thing. The companies are up to their old tricks. Which tricks are you finding particularly difficult?
Well, we know that nicotine is so addicting for young people, and so the industry has come up with products, and this is a new product called the Juul that's especially addicting for young kids. A couple of scientists in California started it to help people get off regular combustible cigarettes, like you were saying. But what they didn't anticipate was, because of technology and how cool it looks, this is like having an iPhone 10 to a teenager. So between having it be good technology and...
So before you get off of that, what does it do? How does it work?
So this has a battery inside of it, and it comes with a charger that you put right into your laptop, and then you charge it up in your laptop or on your computer, and then the battery is charged up. And once you've charged up the battery, then you have what's called a flavor pod. The flavor pod has the equivalent of a pack of cigarettes worth of nicotine. So again, for the adolescent brain, that's a lot of nicotine. Then you insert...
For my brain, it's a lot of nicotine.
It's a lot of nicotine. So after you've charged it up, you put in the pod into the device, and then you inhale it. So the battery is turned down, and then you inhale it. Now, what's particularly troublesome about this is that the kind of nicotine that's in these devices is called nicotine salts. So it's highly concentrated. When a teenager inhales, it gets a big hit to the brain, and it's a very smooth draw in the throat and on the lungs. So it's very attractive for that reason. So you have the flavoring, you have the fact that the nicotine salts get a good hit, and that it's very smooth, so it's not biting like regular combustible tobacco.
I got to say, when I was a kid, they had candy cigarettes that they used to hand out to us. And
Yep.
I mean, this is just way above that in terms of hooking me on a really bad habit.
That's right. So again, for teenagers nowadays, smoking is very bad. Every teenager knows that. Every fourth or fifth grader knows that. So for them, this isn't even about smoking. This is about a piece of technology that you can get a hit of nicotine with, and it's very cool and enticing. So the work that we have to do is to educate both parents, teachers, pediatricians, and doctors about what these devices do, why they're so attractive to young people, and how to help them understand that it's not just water in these devices with some flavoring. The flavoring is also a problem as well, because what the nicotine sits in is propylene glycol. So it's not water. Glycol is like a vegetable-based substance. So when you digest it, your stomach breaks it down because it has acid in it. But when it's going into your lungs, there is no acid. So the little research that we do have on it shows that the glycol slowly starts dripping into your lungs with repeated use, and it can lead to pneumonias or respiratory infections. So that's a concern. Then there's the flavoring, which is a chemical called diacetyl. There's not fresh mango juice or fresh lime juice in these devices.
But even if there was fresh mango or lime, its delivery system into the lungs is still somewhat suspect.
Exactly. We don't want anything going into anyone's lungs and especially young people's lungs.
It's not a normal way of eating stuff.
That's right.
You have the gullet separate from the windpipe for a good reason.
Absolutely. So let me just say the flavoring, this chemical diacetyl, is also troubling because it's what used to be in microwave popcorn until microwave popcorn workers started getting sick in the factories. And when they researched it, they saw that the heating up the diacetyl when you make the microwave popcorn is what was causing these problems with the workers, getting, again, respiratory infections and actual anomalies on their lungs. So FDA banned the use of diacetyl in microwave popcorn. But since these products are not regulated by the FDA or anybody else except for age restriction, they can use the diacetyl to make the flavoring.
So is there anything being done on that front to make them illegal? Because one way of looking at it is it's a drug. We're delivering nicotine.
That's
Why
right.
isn't this a nicotine delivery device and get regulated by the FDA that way?
That's a great question. And the answer up till now has been that the tobacco has a huge lobby. It's very strong, and so far they've kept the FDA from doing any regulations. Now, just 2 weeks ago, I think after the FDA received some letters from the American Association of Pediatricians, or Pediatrics, Heart and Lung Associations, etc., they decided to take some steps because they could see that it was becoming epidemic in proportion. So now the FDA has just come out to all these new companies and saying you have 60 days to prove that you're not going to market to young people anymore, you're not going to sell to young people anymore, or else we're going to pull all these products flavored from your capacity to sell them. The other big problem with this is that children get these products online. So we're not just talking about the retail environment anymore, which we have some control over through regulations and collaborative boards of health programs. But the online sales have been a big problem up until recently on Juul, the website. All you had to do was go in and put in a birth date, then put in a gift card or credit card number, and then put in your address and hit click, and it gets shipped to your house. So you don't have to prove age. And if you have a gift card, which a lot of young teens can get at Walmart if they have some cash or they put together their lunch money with other friends and they go to Walmart and get the gift card, then they could get these products online, also through Amazon, through eBay. And then there's no regulation in terms of, sales. So this all has to be corrected, and hopefully that will happen.
Let's get back to the more fundamental question. What we're talking about is nicotine addiction.
That's
and
right.
The bad area of nicotine addiction to this point had been cigarettes and tobacco products because of the other junk in the smoke. And then we did a bunch of things to get people who are addicted to nicotine to a lesser addiction. One where it was just the nicotine in the patch, or the nicotine in the gum, or the nicotine in the vape, or whatever it was that we're doing. And this was considered to be a lesser evil. Let me play the devil's advocate for a moment. And I know you know the answer to this, so I'm just going to pose the question. What if we had a Juul that didn't have all the other junk in it? It was just straight nicotine, and you were just said, people find this a good thing. Would that be a terrible thing for people to be addicted to? You'd say, well, if you choose to be addicted to something, you can certainly live with that addiction, and it's not the best thing to have an unnecessary substance. What's wrong with that?
Well, as you said, for adults, if an adult wants to quit smoking and they use electronic cigarettes or the vaping devices, we say, well, that's good that you're getting off of combustible cigarettes because there's nothing worse than that. But you're still addicted to nicotine, and we have ways to get you off. But for young people, for young adolescents, the problem with the nicotine is that it is a drug, and it's a drug that elevates your blood pressure. It's, as you know, because you're an MD. It's a vasoconstrictor, so it makes your heart work really hard because it has to pump the blood through a much smaller vascular system. And it's not good for your brain for that reason. So you lose focus, you lose attention, concentration. And again, the long-term effects for young people, we don't know because these are all new products. We know for certain that it adversely affects the adolescent brain and can lead to addiction of other drugs. And we also know that young people are using these devices for other drugs, specifically liquid THC for marijuana. You can Google how to turn your Juul into a marijuana device, and it's easy to do with a pair of pliers, and then you just have to get liquid THC, which is readily available these days, and then you can use it to vape the THC, which has no smell like when you and I were in college or now with a joint. It's just a fruity scent, and it's the same with the vaping. So legalized marijuana is here in Massachusetts. Young people see that it's legal, and so they have some learning and choices to make about how they use these products for marijuana as well. So I would say we don't want young people to use these devices, even if it was just pure nicotine.
All right, now you've talked about sort of the more pressing problem right now, which getting kids addicted to nicotine. I think I agree with you is a very troubling turn of events. How about all my patients that are just old, veteran smokers? What are we doing for the great unwashed out there that are still smoking? And I dare say that most of them would say, I'd quit tomorrow if I could.
We know most smokers would like to quit. Most smokers have tried to quit many times. And getting that final successful quit attempt is really important. We have in Massachusetts the Quit line, which is the free 800 number that's available 24 hours a day for someone.
And what would that number be?
That number is 1-800-QUIT-NOW, and which will be on the screen for people to be able to see.
Great.
And we know that there's trained tobacco treatment specialists that someone can call 24 hours a day. If you don't feel comfortable using the telephone to talk to someone about your health, you can now text or use the computer online to access those resources as well. So that's really important because people can access the resources of a trained specialist. For a provider like yourself, I'm sure you're familiar with QuitWorks, which is the program where you as the provider can fax a referral to the Quit line with the patient's permission because they want to quit smoking or quit vaping, either one. And then the Quit line will call them and say, hi, Dr. Karlin faxed us a referral form for you, and we hear that you're interested in talking to a treatment specialist. So
does it have to be a doctor to do that, or can anybody use the QuitWorks line?
Yeah, any professional, medical professional, a nurse, a therapist, a occupational therapist, physical therapist, psychiatrist, psychologist, counselor, anybody of that nature can fax in a referral. So that helps somebody access resources and counseling. And as I tried to point out before, it's not just the nicotine replacement, although that's really important. We know how hard it is to quit nicotine, and having to understand what a craving is, how to understand what the triggers are for using products, and how to change your lifestyle so that you're putting more movement into your life, changing your diet, recognizing the cravings, learning how to do some deep breathing, some meditation, maybe a little mindfulness. That's been proven to help people quit.
I actually do that in my office all the time. I've just got to point out, Mark Twain spoke about this years ago. He said, quitting smoking is easy. I've done it thousands of times. And I think that's where we stand. So maybe you could go through the simple thing. What I often tell patients is that when you have an urge, and you'll recognize it, I asked them the question. I said, how long, if you did nothing, would it take for it to pass? And most of them think that it won't pass until the next millennium. Um, what do you tell patients about how long it takes for an urge to pass?
Right, and that's a really important point.
How quickly?
Well, it depends on the person, but, a couple of minutes, a couple of minutes. And that is, in that couple of minutes can mean the chance to take a new step and opportunity to recognize your behavior and change it.
So at that point, Tina Grosowsky, where you are a yoga meditative whiz, maybe you could teach us just to do a quick 10 seconds or 40 seconds, whatever it takes, to show us how to do some meditative breathing, which is what I tell patients to do when they have an urge, because I think it cuts that few minutes down to no time, and you can do an urge. How do you do that? Can you do that with us?
Well, meditation, mindfulness is the basis of meditation. So mindfulness is just the pure paying attention from moment to moment. So, getting a posture that's comfortable, resting your hands in your lap if that's comfortable for you, and picking a place to look at ahead of you, or closing your eyes, and tuning in your attention to the breath is the basic method. So following your out breath is what we usually teach people. So as we're sitting here, you and I are talking. If we stop talking for 30 seconds, we pay attention to the out breath as it goes out our nose, or the rise and fall of our chest. And as you pay attention to that out breath, the more you pay attention, the more practice you're having at paying attention to it. And then you begin to have some awareness of the rest of your body. And gradually, if you do it for a long enough time, then you become more familiar with your own breath, your own breathing, and your own thought patterns again.
So I'd like you to comment on how I do it, which isn't quite as...
There's no one right way.
Obviously. But what I have my patients do, and it has worked with a bunch of them, they say they can quit 1 or 2 cigarettes a day.
That's great.
Simply by breathing. What I have them do is I just say, get calm the way you did it much better than I do. But I just say, follow my hand. You're going to inhale for a count of 5, hold for a count of 5, exhale for a count of 5, hold for a count of 5, and just repeat it 2 or 3 times. And when they do that, I can watch them in the office. They just the fight, flight, or fright response just disappears, which is part of what the urge is about. And it goes down a notch. But you can come to the office anytime and teach some of the patients how to focus on their out breath and just be aware of themselves. But giving patients tools
Yes.
at the moment of decision is really the hardest thing.
And it's great that you have a little bit of training, it sounds like, and you ask about it with your patients, which most providers have to do these days. And providing, asking and referral and treatment at every visit, I'm sure, as you know, is really important. So that, they may not be ready to quit this time, but when they come back, they can say, well, I smoked 5 less than I did 6 months ago when I saw you before, and how you can keep improving on that, helping them.
When patients smoke, I ask them to come in monthly until they've quit, to give them the sense that this is as important as following, your hypertension meds or your diabetic meds.
Right.
If we can get people to stop smoking, it's just such a huge boon to how we practice. Do you have other programs that you're doing to slow the rate of tobacco use?
Well, we work on smoke-free housing, as I mentioned to you before, so that everybody who lives in public housing in Massachusetts has an environment where they have the right to clean air. and especially where there's families who live with children in smoke-free housing. We'll work with anybody in private, low-income housing as well. So we've had a lot of success with that over the past 5 or 6 years, and most public housing in Central Mass is tobacco-free, which is really important, and providing cessation resources to those people is really important as well. So we know that making regulations, increasing taxes on tobacco products, making counseling available, working on prevention for young people, and media is certainly very important, a component to the statewide program that we have as well. So all of those together we've been successful driving down smoking rates. So now the new challenge of working on the juuling and the vaping products, we know in the past what's worked, and we're hoping that applying all of those same tactics to these products will work as well.
Well, and it mirrors some of the stuff that we do in the office. We'll often tell patients to make zones in their house where they don't smoke, or to say, geez, I'm not going to smoke in the house, or I'm not going to smoke in the car. And it helps people to stop, which is really what most people who smoke want to do. They want to stop. And so if you say, well, don't buy any cigarettes at the signs, your trigger issues or like that.
And the other is, I'm sure you talk to them about how much it costs to have a nicotine habit. So for the average smoker who smokes a pack a day, they could save up to, $4,000 a year with if they're smoking regular brand name cigarettes in Massachusetts. So, looking at the financial cost, both long-term and short-term, of giving up nicotine addiction. Even if in the short term it costs money for the nicotine replacement, which in Massachusetts, if you're on Mass Health, as you know, are free with a prescription. So,
well, Tina Grosowsky, you have been a wonderful guest, and we can do this many times. It's worth repeating and repeating again and again and getting people to stop smoking. But unfortunately, we're out of time. And this is another edition of Health Matters, brought to you by WCCA-TV and the Worcester District Medical Society. My guest tonight has been Tina Grosowsky of the Central Mass Tobacco-Free Community Partnership, and also just a lovely person that helps us stop smoking. Thank you again.